Okay, so I want to ask the Chief Medical Officer this question. Based on the model that your ministry might be working with, how do you see this virus affecting St. Vincent and the Grenadines over the next 3 to 6 months? And as a supplementary to that, what is your worst case scenario?
Okay, so as we're all aware, this is a new disease. And as you've been following internationally, in China, in the US, the models have been changing. So you can get different models which will say different things. However, there's a model coming out of the Imperial College which requires a certain number of cases over a particular time in order to apply it. So when you ask about what is the projection or the model that we are looking at, that is something that we have been working on, and it's been changing with time as we get more information. And at this point, we would not wish to put a definitive figure on that, but as the Prime Minister mentioned earlier today, we are looking at, so for example, over 250,000 masks, because whatever figure we are dealing with, we need to ensure that, again, I have to stress that the greatest risk is to our healthcare providers. So we are working the models, but as numbers change and as we are in different contexts and you have different healthcare systems, you have the capacity to do different tracking and to contain persons, that's going to affect the way in which you interpret a different model and therefore how you come up with figures to plan. So I would leave it at that. I'm not going to give you a figure because we are early in this and there are different contexts, so you can't just transfer one model from England or the US or from Wuhan to St. Vincent, or even from Barbados to St. Vincent.